Hi, this is Dr. Kingston, and in this video I'll be talking about the regions of the tongue and their innervation. The objective for this video is to describe those regions of the tongue and identify the nerves and modalities, so motor or sensory, that serve those regions. We're going to start off by very simply dividing the tongue up in four regional directions. So that first division will be superior-inferior. The superior surface of the tongue, so we'll divide it just like that. That superior surface of the tongue we'll call the dorsum of the tongue, and the inferior surface we'll call the ventral surface. The second division will separate the anterior two-thirds of the tongue from the posterior third. So this anterior is called the body, and this posterior section is called the root of the tongue. We're going to start off talking about the dorsum of the tongue, as there's a lot more going on here in terms of surface anatomy. There are two large sulci that are going to divide the tongue into anterior and posterior, right and left. The terminal sulcus is what divides the anterior body from the posterior root on each side. So there is technically one on the left and one on the right. And the median sulcus then is going to divide that posterior tongue into right and left halves. This is actually sitting directly over a fibrous septum in the midline that extends all the way down into the body of the tongue here, and is going to separate the right musculature from the left musculature. Now, where all of these sulci meet up, there is a small depression called the foramen cecum. This makes for a nice little intersection point, but it's actually an embryological remnant left behind by the formation of the thyroid gland. So we're going to use that terminal sulcus to divide the tongue up into the lingual root and the lingual body. The root of the tongue sits roughly in the oropharynx, and because of this, it's going to follow the pattern of sensory innervation for the oropharynx. It doesn't have any sensory papillae, it doesn't have any taste buds or touch papillae, but it does have a very rugose appearance. That comes from the lingual tonsil, which is a mass of lymphatic nodules that cover its dorsal surface. So this is part of a larger lymphatic ring in the pharynx that we'll talk about more in future sessions. So for right now, it's enough to just understand that it's there. The body of the tongue, or that anterior two-thirds, sits roughly in the oral cavity, and again, it's going to share that pattern of innervation. The body of the tongue is very muscular. It's home to all of those intrinsic muscles that we looked at in a previous video, and it has attachment points for all of the extrinsic muscles as well. This is additionally where all of the lingual papillae are found. These are often referred to as taste buds, but they're also going to include some touch receptors. We think of the tongue as being primarily in the oral cavity, but it's also important to take note of its relationships with the pharynx and larynx. So to orient you here a little bit, here is the soft palate and the uvula, and here is that very rugose lingual tonsil on the root of the tongue. The tongue is anchored to the epiglottis, so that first, most superior laryngeal cartilage. And there are three mucosal folds that do this. So we have on the lateral sides the lateral epiglottic folds, there and there. And then there is a medial epiglottic fold attaching up to the midline of the tongue as well. In between these folds are the epiglottic valleculae, or spit traps as I like to call them, which are going to collect saliva that flow into them until you're ready to swallow it. So that's this area right in there. This keeps the saliva from heading down into your larynx and trachea unexpectedly, which would be bad. Now, the ventral tongue is not divided up into any additional regions. It's tethered to the floor of the oral cavity by the lingual frenulum, and on either side of that you can find those sublingual caruncles and the opening of the submandibular ducts. Running laterally from those, you have the sublingual folds, which are covering up the sublingual salivary glands and house the openings of their many little ducts onto the oral floor. And if we move up off the oral floor, we can find these little fimbriated folds of mucosa that are going to be tying the floor mucosa up to the lateral tongue. Medial to those, we have this dark stripe. These are the deep lingual veins that are visible through the mucosa here. And the reason they look so dark is that they're very superficial from this angle. So they're sitting just beneath that mucous membrane. You can take advantage of this placement when you're administering medication. So medicines that are given sublingually will absorb into the bloodstream very quickly thanks to those veins' proximity to the surface. All right, now that we got some regions of the tongue delineated, let's use those to talk about innervation. Motor innervation is going to be the easiest to begin with because both the root and the body of the tongue are innervated by the same nerve. All of the muscles, minus palatoglossus, which is a palate muscle, that move and change the shape of the tongue, are going to be innervated by the hypoglossal nerve. The hypoglossal nerve exits the cranium through the hypoglossal foramen near the foramen magnum, and it travels inferiorly and anteriorly through the neck. So we can see that coming down here as it crosses lateral to the external carotid branches and enters into the submandibular triangle. It is going to pass deep to mylohyoid to enter the oral cavity. So we can see it coming up here, and it is going to send its branches up to those tongue muscles from an inferior position. All right, so far so easy. So let's go ahead and complicate it a little bit. Sensory innervation from the tongue is carried by separate nerves from motor innervation. Not only that, but we have two types of sensory innervation here. We have somatic touch sensory and special taste sensory. And the nerves that carry them are going to be different for the anterior and posterior regions of the tongue. So we're going to start up here with this posterior third, which is the root of the tongue plus this row of very large taste buds called valate papillae. So remember, the root of the tongue sits in the oropharynx, and so it shares innervation with that region. Somatic sensory innervation to the oropharynx is carried by the glossopharyngeal nerve, and lo and behold, that's exactly what we're seeing here. For this posterior region, both taste and somatic sensory are going to be carried by that glossopharyngeal nerve. The glossopharyngeal nerve exits the cranium through the jugular foramen along with the vagus and accessory nerves and the internal jugular vein. It makes its way down into the pharynx by riding on the posterior surface of the stylopharyngeus muscle. So we can see that happening right here. Here is the glossopharyngeal nerve, and this guy right behind it is the stylopharyngeus muscle. From there, it is going to enter into the pharynx by slipping in between the superior and middle pharyngeal constrictors. So we've got our superior constrictor up here, and we've got our middle constrictor right here. So this is going to be slipping in to that gap in between them. From there, it's going to distribute its branches via the pharyngeal plexus, and some of those fibers are going to make their way to the posterior tongue. So while this area is mostly nice and simple, there is just one little exception. There is always one little exception in anatomy. So recall that the vagus nerve innervates the larynx, which begins at the epiglottis, and some of its fibers are going to have an overlapping territory on the very posterior-most aspect of the root of the tongue. And these are going to be carrying some somatic sensory innervation. Okay, you can see this area here indicated by the purple stripes. The specific branch of vagus involved here is the internal laryngeal nerve, and that is a branch of the superior laryngeal. So we can find the superior laryngeal coming down right here. And that is going to pierce through the thyrohyoid membrane and enter into the larynx to become the internal laryngeal nerve. So this will be sending off some fibers up this way to innervate that posterior-most aspect of the tongue. So that takes care of the posterior tongue. The anterior tongue gets somatic sensory innervation from the same source as the rest of the inferior oral cavity proper, which is the lingual nerve. The lingual nerve is a branch of the mandibular division of trigeminal that originates in the infratemporal fossa deep to the mandibular ramus. So in the photograph here, you can see the mandibular ramus has been cut. You can see your inferior alveolar nerve heading that way, and the lingual nerve heading anteriorly and inferiorly into the oral cavity. It's going to dive deep to the oral mucosa, which sits underneath the tongue, and we've seen a few times now that it is attached to the submandibular ganglion, which is where parasympathetics from the facial nerve synapse to get to the submandibular and sublingual glands. So that ganglion is right here. Okay, I'll just color it a little bit so I don't cross off the arrow there. And you can see it's got some branches heading this way to the sublingual gland and some others down here to the submandibular glands. The bulk of the lingual nerve, however, is going to loop underneath the submandibular duct. So submandibular duct, if you follow the arrow, is right here. Okay, so the bulk of the lingual nerve is going to come up underneath of it like so, and it will distribute its branches to the tongue thusly. The special sensory for the anterior tongue is carried by the chorda tympani, which is a branch of the facial nerve. To get where it's going to hitchhike with the lingual nerve that we just saw. So let's take a look at how it does that. Now, as we're going to see in much greater detail in future sessions, the chorda tympani will branch off of the facial nerve within the temporal bone, and then it will emerge from the cranium in the infratemporal fossa. You can actually see it here in this image, but it is very tiny, so I will highlight it for you. All right, so here is chorda tympani. It's coming down into the infratemporal fossa, and it's going to run anteriorly and inferiorly. As it comes up to the anterior edge of the mandible here, it is going to join up with the lingual nerve, and let me just choose a different ink color here to highlight that. So here's our lingual nerve in blue. It's a branch of V3. I'm going to run down, enter into the oral cavity here. And you can see right around this area here that the chorda tympani not only runs as a neighbor to that lingual nerve, but it actually joins right up against it. Now, these are still considered to be separate nerves. They're wrapped in their own fascicles, but they do run pressed along right up against each other. All right, so just to review here, the somatic sensory from the anterior tongue will follow that lingual nerve, that blue nerve, back up through V3 to get to the brain. But taste sensation will follow the chorda tympani back to the facial nerve to get back to the brain. So two separate pathways once they leave the oral cavity. Let's do a practice question to test what you've learned. The correct answer here is C, dry mouth. Now, this is a multi-step question and a little bit complicated, so let's walk through why this is the answer. All right, so we have a patient reporting decreased sensation on the anterior right aspect of their tongue. All right, we think it's a nerve injury, but to prove that to ourselves, we'd like to see some additional symptoms. So what symptom of these is most likely to experience? All right, so we need to figure out what nerve is responsible for taste sensation on the anterior right aspect of the tongue. And that is going to be that right chorda tympani. Okay, and knowing that, we can use that to answer the question. Does the right chorda tympani carry taste sensation from the left tongue? No. Does it carry taste sensation from the posterior right tongue? Nope, that's glossopharyngeal. Would the musculature on that side be paralyzed? Nope, that's carried by the hypoglossals. So by process of elimination, even if you weren't sure, you could work out that dry mouth was the most likely answer here. Now, the reason it absolutely is the correct answer is because the parasympathetics that innervate both our sublingual glands and submandibular glands are also carried by the chorda tympani. So any injury to that chorda tympani nerve would not only affect taste on that side of the tongue, it would also inhibit secretion by these two salivary glands. All right, so dry mouth and decreased taste go hand in hand. And that is going to bring us to the end. Thank you for watching.